Hi, today I'm going to be talking about recovery after hysterectomy. I'm Dr. Janani Manoharan, laparoscopic surgeon, robotic surgeon, infertility specialist, obstetrician and gynecologist. So hysterectomy, why is it done? It's a removal of the uterus and it's done for various causes for which your gynecologist may suggest a hysterectomy to you. In this video, I'm going to be talking to you about how you can recover after getting a hysterectomy done. So by and large, the first 24 hours after the hysterectomy may be a little stressful. You may have a little bit of pain, which is understandable because your body has undergone such a big stress. So what I usually do suggest for my patient is to do some breathing exercises. But before that, let's go to what you should do before getting the surgery in itself. So recovery after a surgery or after any stressful event for that matter depends more on how your body is before the stressful event. So if you are suggested by a gynecologist for a hysterectomy, what I would recommend for you to do is to pump up your body and be ready for the stress inducing event. How you can do this is by taking care of the other parameters regarding your health status. Like for example, if you're a diabetic, I'd like for you to get your sugars under control. If you're hypertensive, get your blood pressure under control and visit your physician and get your medications as suggested by the physician. And there are many women who also suffer from thyroid disease, which can interfere with anesthesia. So I would suggest for you to get your thyroid also under control. That is the medical aspect of it. The diet aspect of it, what I usually suggest for my patients is to have a healthy iron-rich diet, which would help in bridging the blood loss during the surgery. So your body will not feel the blood loss as much. So we would definitely encourage you to have a healthy iron-rich and fiber-rich diet before the surgery. And as for your physical status of your body, I would encourage for my patients to be more physically active during the period leading up to the surgery. You can learn some breathing exercises. Nowadays, there are a lot of YouTube videos. If you're watching this, you are on YouTube. So you can Google up some breathing exercises which can help you and your body to recover from the stress. So this is about what you can do prior to your surgery. And during your surgery, on the day of your surgery, the most important factor is not to get stressed and anxious. I know that's such a cliched statement, and of course any person going under the knife is going to be stressed and anxious, but I do suggest for my patients to dial it down as much as possible and try to think about happy moments in your brain while during those few moments that is leading up to the surgery. And after the surgery, of course, it's going to be very painful because your body has just undergone such a major stress. What I do suggest is to do breathing exercises in the first few hours after the surgery, when most often you may be groggy or you may be immobile because of the anesthesia. Breathing exercises do help you a lot, and you can continue this throughout your recovery period. And with modern anesthesia, you most probably will be coming out of anesthesia within the first 24 hours of your surgery, and on an average it's much earlier. So as soon as you come out of your anesthesia, I do suggest, even though it may be a little painful and uncomfortable, to be as mobile as possible as soon as possible. This would help for your muscles to recover from the stress as quickly as possible and prevent the buildup of stressful hormones and stressful elements in the body. So you moving around as quickly as possible after the surgery will help you. And usually during the surgery, they will be putting a little tube into your bladder for you to empty your urine. So if you move around as soon as possible, they will remove that tube also, which again will prevent a lot of other complications like urinary tract infections, and also will reduce the discomfort because of the tube for you. So those are the ways in which you can help with your recovery while you're in the hospital. And when you go back home, by and large, people do recover from a laparoscopic hysterectomy and a vaginal hysterectomy within 2 to 3 days. So by 2 to 3 days, you can go about doing your daily business. Like you can do a little walking around the house, you can do some cooking maybe. But I generally do advise my patients not to carry heavy loads or squat or walk up the stairs or do vigorous exercise for about 5 to 6 weeks after the surgery. So take it slow. And also I would suggest for my patients not to have sexual intercourse or use tampons or other penetrating devices into the vagina, which can again injure or hurt the vagina post the surgery. This is just to give time to the vagina to rejuvenate and recover from the surgery. So take it around 4 to 6 weeks. Beyond that, you can use tampons or you can go swimming and things like that. And also after about 2 months, say 2 months after the surgery, I do suggest for my patients to do Kegels exercises. These exercises are very simple. what you can do is, it is like if for example you're in a meeting, or you are in a classroom or a theater or something, and you want to pee urgently. So what would you do to control your pee? You're going to squeeze your pelvic muscles. So that's what you have to do. So there is a short squeeze and a long squeeze. A short squeeze is a squeeze that is lasting only for a second or so. A long squeeze will be lasting for about a few seconds more. So first try it slow, do a few short squeezes now and then during the day. You can do this at any point of time during the day, like while watching television, or while reading a book, or while cooking, or doing any of your daily activities. So but make it a habit to do these exercises as often and how well you can do them. All right. Okay, so do these exercises as often as possible, and also take it slow, take it stepwise, and do as many as you can. All right. I hope this video helps you. If you have any doubts, you can put it down in the comments below. We will get back to you. Thank you so much.
Book your surgery appointment on pristyncare.com. Pristyn Care.